My name is Jonathan Chapman, and I serve as the Executive Director of the Louisiana Primary Care Association. The association is now in its 30th year, representing the state's 28 federally qualified health centers, also known as FQHCs. These providers of comprehensive and preventive health care receive federal funding through the Section 330 of the Primary Health Act. These health centers are located in underserved areas. They operate under a consumer board. They also provide health services along with dental and behavioral health. They provide these services regardless of the ability of the patient's ability to pay. They charge for these services based on a sliding fee scale. They also comply with all other program expectations and applicable federal and state regulations. Today we're here at RKM, Primary Care Providers for a Healthy Feliciana in Clinton, Louisiana to discuss a little bit more about the association and give you a good representation of the FQHCs and the services they provide.
I'm Doree Gillum, nurse practitioner and the clinical director of RKM Primary Care, which is one of the federally qualified health centers here in Louisiana. And today we're going to show you the center and the many services that we have, our comprehensive services, including many different types. This right here is the registration area. We have 4 different registration booths, and registration includes checking the patients in, also getting their information for insurance or their lack of insurance, and doing a sliding scale fee and helping them out getting everything started. We have 2 wings for primary care services here in this building. Primary care is one of our largest areas of service. We have 10 rooms in this wing and 10 in the other, with 4 specialty rooms. And now I'll take you to one of our patient rooms. This is one of our primary care operatories. It's a typical room. As you can see, we have an exam table, all of our monitoring equipment, and we also have electronic health records. We're paperless, and everything is in the electronic health record. We see approximately 50,000 visits a year, including 3 to 4 parishes. And we see every type of patient, do some minor surgeries, primary care. We do cardiology here. We have ophthalmology. We do behavioral health. We also have some dental suites that we'll be showing you. Dental health is very important. Here we're in one of our 5 dental suites. If we didn't have dental care for our patients in this area, some of them would not have any dental care at all. It's extremely important to the overall health of the patients. This is our state-of-the-art telemedicine equipment, which is a very important part of our practice. It is very difficult to get specialists out here in the rural area, such as ear, nose, and throat, or cardiology, and behavioral health. So we use this equipment to contact and bring in our specialists. We have a psychiatrist that does his visits on the telemedicine equipment, and it services our patients. They won't have to go all the way down to Baton Rouge or to New Orleans for their care, and sometimes they can't get there. They don't have transportation. So this provides something that is very difficult for our patients to get.
Before the clinic, we had to travel all the way to Baton Rouge, which was about 40 miles, 45 miles to a clinic. And now since they've been here, it cuts time because it's only about 5 minutes from our home.
My treatment for me and my family at this federally qualified health care center has been fantastic and great. Matter of fact, it's been life-saving. I had a problem with my heart and didn't realize it, and came up here and they diagnosed the problem and sent me to the right place. So if they know that if there's a bigger problem that they can't handle, they can recognize it and send you somewhere else. But all of the other experiences have been fantastically great.
Some of these health centers do not receive federal funding. They can receive a designation as a look-alike. Louisiana currently has 28 federally qualified health centers across the state, both urban and rural, north, east, south, and west. The association for these health centers provides legislative advocacy, community development, emergency preparedness, fiscal management, quality improvement, workforce development, and board training. I appreciate your time today, and I hope that you enjoy and find this video informative.
My name is Donald Hunter, and I'm Membership Services Coordinator with the Louisiana Primary Care Association. FQHCs are not just for the poor, but they're for everyone. We see private insurance patients, Medicaid patients, Medicare patients, and of course those that are uninsured. There are 4 basic models throughout the state. There's the community health care model, there's the migrant health center model, There is the healthcare for the homeless model and the public housing primary care model. And of course, each one of these models are strategically designed to reach out to a certain population type that's medically underserved, even though the services are available to everyone. One of the earliest models of federally qualified health centers is the Migrant Health Center model, and it was created with the Migrant Health Act of 1962. After that model came the Community Health Center model, which at that time was referred to as the Neighborhood Health Centers. It was created under the Economic Opportunity Act of 1964 during the presidency of Lyndon B. Johnson. Around the mid-70s, we had about 100 neighborhood health centers throughout the nation. Currently, we have up to about 8,000. After that, in 1975, community health centers were moved under the authority of the Public Health Services Act. And also under that same act, the Migrant Health Center program was also reauthorized. After that, of course, historically in 1987, the Stuart B. McKinney Homeless Assistance Act created the first homeless healthcare model. And that specific act authorized 15 different programs which was strategically chosen to receive funding to provide healthcare services to homeless populations. So if you were an educational facility that served homeless populations, or if you were a transitional housing facility, you were eligible for those monies. And then in 1990, the Disadvantaged Minority Health Improvement Act came along and created the public housing primary care sites. Health centers have traditionally enjoyed bipartisan support from Congress and different presidential administrations. Under the Bush administration, the Health Center Initiative came along, and it provided for $2.2 billion over a period of 5 years to fund community health centers. And health centers continue to be funded under the presidency of Barack Obama through the Patient Protection and Affordable Care Act, which appropriated $9.5 billion for the operation of community health centers and $1.5 billion for constructions.
This clinic has meant to me and my family a life-saving facility. When I first came here, I was transferred from Lally Kemp Charity Hospital, and the reason why I was transferred here was because I was having a blood pressure problem. And once I got here at RKM in Clinton, Louisiana, I met Ms. Judy Barker, who is my primary care person now, and she saved my life through giving me different type of medication, and plus she gave me some fluid pills to control my blood pressure problem.
Hi, I'm Tonya Canale, Registered Nurse and Quality Director for Louisiana Primary Care Association. I want to take this opportunity to talk with you about community health centers, also known as Federally Qualified Health Centers, or FQHCs. The Federally Qualified Health Centers see a vast array of patients. Any patient presenting for care will receive care. During these tough economic times, cutbacks to private, state, and public health centers, these federally qualified health centers are needed now more than ever. According to HRSA's Bureau of Primary Care Uniform Data System report for 2010, the FQHCs in Louisiana managed over 200,000 unduplicated patients, of which over 90,000, or 44% of the FQHC patients were uninsured. Likewise, there were 38% on Medicaid and 11% private insurance. Another 9% of the FQHC revenues came from self-pay clients. The FQHCs strive to provide the highest quality of care at all of our facilities. They are held accountable to national standards and practice by nationally recognized and published clinical practice guidelines. All are either recognized or working toward recognition as a patient-centered medical home by one of the national organizations such as NCQA, National Committee for Quality Assurance, the Joint Commission, or the Accreditation Association for Ambulatory Health Care. In an online study published in the American Journal of Preventive Medicine on July 10th, it was found that patients who obtain care from government-funded community health centers, the FQHCs, can rest assured that they can receive the care that is as good as or better than care delivered in a private practice. The researchers found that in 13 of the 18 categories, community health center physicians perform just as well as their counterparts in private practice. And in the remaining 5 categories, they adhered to guidelines significantly better. Community health centers demonstrated equal or better quality performance than private practice on ambulatory care measures, despite serving patients with more chronic diseases and more socioeconomic complexity, according to the authors.
We've been able to come in even when we don't have an appointment and be seen within 15, 20 minutes and get a prescription medication, shot if we needed it immediately and out of here within 30 minutes.
What has the clinic meant for you and your family?
A lifesaver. It has really helped us a lot, save time and money. Plus, when we didn't have insurance, they were able to help us out a lot.
If it wasn't for this clinic, golly, I'd have a 100-mile trip to Baton Rouge to a doctor there, at least 100 miles, and it would 100 miles round trip, and it would kill a half a day in the traffic and so forth. So it's just easy to come here early in the morning. They get here at 7:30, or come late at night. Sometimes they're here till 7 o'clock. So it just makes it much, much more convenient to be here.
Only thing I can say is they are remarkable and they saved my life.
RKM, primary care providers for a healthy Feliciana. Baton Rouge Primary Care Collaborative. Capital City Family Health Center. Common Ground Community Health Clinic. Excelf Incorporated. Jefferson Community Healthcare Centers. Morehouse Community Medical Centers.
Congress and various different presidential administrations realize that health centers are the solution. 14% of all Medicaid beneficiaries are health center patients, and we only account for 1% of all health center costs. We also save the healthcare industry $24 billion annually, and we save Medicaid $6 billion annually. Health centers keep patients out of emergency rooms, and we keep our patients healthy. So the conservative choice, the smartest investment, is to invest in federally qualified health centers.
As a patient, your care needs to be managed by a primary care provider who can coordinate all of your care. The primary care provider is responsible for all of your preventive care, as well as the management of any chronic conditions. Other primary care services include dental and mental health, and specialty referrals are made as deemed necessary. As the Association for the Federally Qualified Health Centers, we support their work and would like to provide your care. We invite you to call or visit any of our community health centers located throughout the state. Come in and begin or continue your health care with one of our centers. Let our center become your medical home.
If it wasn't for this clinic, we would have to go all the way to Baton Rouge and have to put up with traffic, the waiting, the lines, the hours we would have to wait. Since RKM has been here, it has been wonderful for us. We do not have to wait. I've had family friends that come here now.
Well, I feel like the staff cares very much about the patients. They always treat you with dignity, with courtesy, and with respect, and they're concerned. They even follow up with your visits. Often they've followed up and asked me, hey, is everything going all right? Am I doing okay? So I think the staff is very concerned and dedicated and really doing a good job.
If it wasn't for this clinic, I don't know where I would be now. probably deceased or probably somewhere looking for somewhere else. But this clinic, I can say this clinic here really saved my life.
Investing in FQHCs makes sense. They lower healthcare costs and they create jobs in the communities that they serve. So if you would like to receive more information, or if you're interested in becoming a patient or learning where these health centers might be, please visit our website at www.lpca.net or call us at 225-927-7662. Again, thank you for your time.